Welcome back to another episode of Your Health, Your Priority. It's your host here, Nurse Onyoko Precious. And here with me is my guest, Nkechi Breze, a public health practitioner and a digital health promoter. Welcome. Okay, please, in a very simple term, can you explain to us what diabetes is and what are the signs and symptoms that we will see and you will tell, okay, person has diabetes?
Okay, thank you very much. Diabetes is a chronic condition that is marked with an increase in sugar levels. So it is a non-communicable disease that when a person has it and the person has an increased glucose in their blood stream. So the signs and symptoms can include um, excessive sweating in the night during night sleep. It can include increased thirst when somebody is frequently having thirst. It can also include fatigue, unexplained weight loss, and it can also have blood vision and etc.
All right, since we're looking at diabetes and hypertension today, so in simple terms, can you explain to us what hypertension is and what are the signs and symptoms a person will see and you will tell this person is hypertensive?
Okay, hypertension is a very chronic disease. It's just as diabetes, a non-communicable disease that is marked with an increase or elevated blood pressure. The pressure at which the blood is passing through the arteries of the body increased, which is normally from the above the normal blood pressure range. The normal blood pressure range is 120 of systolic and 80 of diastolic. So any blood pressure that is consistently above 120 over 80 is said to be hypertension. So the signs and symptoms can include headache, increased or elevated blood pressure. We are consistently having above 120 over 80. Thank you.
Okay, so what is the relationship between this hypertension and diabetes? What is the relationship between the two?
Okay, hypertension and diabetes, most researchers and most scientists refer to them as comorbidities. What we mean by comorbidities are they are diseases that go one with the other. So, for example, somebody might have diabetes, and most patients from research, most patients that present with diabetes have been seen, hypertension, sorry, have been seen to have diabetes, and most patients that have diabetes have been seen with hypertension. So the relationship there is diabetes. When a person is diagnosed of diabetes, or when a person is diabetic, and if it's not properly managed well, it can lead to what is called diabetic nephropathy. That's the diabetes attacks the kidney, and you know that kidney helps in ozone regulation and also in regulation of blood pressure. So when the kidney is not functioning, the person tends to develop hypertension. That's the relationship between them.
Okay, you want to tell us that both hypertension and diabetes they affect the kidney.
Yes, both affect the kidney.
In what way?
Okay, when we say hypertension, we say that hypertension is an increase in blood vessel, increase in the blood pressure, the pressure that is moving across your veins. And we all know that all our organs and systems need blood for them to be alive and to function. So the kidney also has what is called the renal nerves and the renal veins, which supplies blood to you. So when there is increased pressure in these veins and they rupture or they become damaged, so the blood supply to the kidney is cut short, and the kidney is damaged. And when the kidney is damaged due to hypertension, due to maybe diabetes or hypertension, it affects each other. Like when diabetes occurs, and it's not affect the kidney, and when hypertension occurs, it's not managed, it affects the kidney. So each of them, if diabetes first of all occurs and is not managed and the kidney is damaged, it leads to what? Hypertension. Yeah.
Okay, so are there ways that these both hypertension and diabetes can be treated? If no, they can be managed. What ways can we manage both?
Okay. Frequently, there have been ongoing researches in science field relating to the cure of diabetes, and there have been innovative ways to cure diabetes. But as of now, there is no cure for it. It's just management, just management. So for diabetes, for you to manage diabetes, first of all, you must make sure to know your family history. That is, because diabetes most times it tends to be in lineage. So because we didn't talk about the types of diabetes, you have mainly three types of diabetes. You have the type 1 diabetes, which you have type 2 diabetes, and you have gestational diabetes. So most times the risk factors of diabetes starts with the family history. Somebody having a parent or a grandparent that suffered from diabetes, and the person is at risk of having it. So for you to manage, first of all, you have to know your family history. Then if the disease occurs, you are not diabetic, you must make sure that you monitor your sugar levels always. If you are needed to take your insulin, make sure that your insulins are available for you to take your shots. And then dietary modification, you modify your diet, eat food that are low in sugar and also high in fiber. Then also adequate exercise, not strenuous exercise. You do exercises that are adequately for you. So these are the few ways to manage diabetes. For hypertension, the best way to manage hypertension is first of all, you have to regularly check your blood pressure, monitor it. Then you do lifestyle modification, you engage in physical activity, you watch what you eat, and reduce intake of high sodium foods, food that are high in salt. Then you also know your family history, because hypertension can also be genetic. Then you do well to manage your stress, have enough rest and enough sleep. These are the few ways to manage hypertension. So hypertension and diabetes, if somebody has diabetes or a diabetic patient, make sure you monitor your blood pressure, because most times diabetes might not be able to be detected on time. So when the blood pressure is continually increased, you see some patients coming and their blood pressure is normally increased, and the doctors do everything possible, and that will not be pointing them, okay, let's just check the sugar levels of this patient. And when they do a check, find out that it's constantly high. So most times, even people that go for eye checkup, most times diabetes have been identified in patients through eye checkup. That's when we talk about diabetic retinopathy. So there can be a detachment in the retina, there can be a scar in the retina, and it will be pointing down to diabetes. So always go for your medical checkup 8 times in a day. Make sure that you visit your doctor, you do your full body check, your BP, your sugar levels, and monitor what you eat, and always be physically active.
Okay, to round it up, apart from genetics, are there other risk factors for
Yeah.
both diabetes and hypertension?
Yeah. So remember, first of all, when I told them that when I said that diabetes and hypertension are comorbidities, yeah, they share common risk factors. For diabetes and hypertension, they share common risk factors. Number one, you have obesity, can be a risk factor for hypertension, it can be a risk factor for diabetes, and you have family history. People that had their parents or grandparents of diabetes or hypertension can also be a risk factor. Age can also be a risk factor. So that the more people tends to age, yes. Yes, obesity too. I've talked about obesity. It's also a risk factor. Then the gender, women tends to have more risk. They are more at risk of having hypertension and diabetes as compared to men. Yeah. So then the lifestyle is also a big risk factor. So when you live a sedentary lifestyle, a lifestyle that is not active, you don't engage yourself in physical activity, you also stand the risk of having hypertension and also diabetes. So these are the few risk factors for diabetes and hypertension.
Alright, this has been a wonderful session. I totally enjoyed it. Thank you so much. Just like you rightly said, hypertension and diabetes, they go hand in hand. So most of the times when you see somebody has hypertension, the chances of them being diabetic is there, right? So if you notice that, okay, this is in your gene, like your mom has it, or maybe your grandparents have it, is a call for you to check yourself, check what you eat, check your lifestyle and the things you do. That way you can prevent yourself from having it. But if you already have it, the least you can do is to take your medication, ensure that you visit your doctor, and when you're being given your medications, follow it up. I've noticed that a lot of times people with hypertension especially, they don't take their drugs.
Yes.
Whenever they check their BP and they feel like, okay, it's down, they don't take it. No,
There's no adherence.
hypertension cannot be treated, we are now managing it. So because you're managing it, you're supposed to take your drugs.
And most importantly,
Okay.
don't share your drugs, because I've seen so many cases when people come to us and they tell us that I'm a hypertensive person, and the drug I took was from my mom or from my friend gave me. You don't share hypertensive drugs, because everybody's cause of hypertension is different. When we look at the causes, they are different. So there are different ways of managing them and different drugs for each person. So you don't go and take a drug that is not prescribed for you. So it might not work for you, and at the end of the day, you will not be saying that I took a drug and it's not working for me. So make sure that you visit your doctor and get a prescription for yourself.
For yourself.
Yeah.
All right, thank you so much for joining us. I hope you learned one or two from us. And this is me also saying thank you for the last video we did, your comments, you both reached out to us. We really do appreciate. And until next time, you do have a wonderful day.
Thank you very much. It is always nice seeing you guys. Bye.